Hello, my name is Dr. Alex Reed, and I'm a licensed clinical psychologist and assistant professor in the Department of Family Medicine at the University of Colorado Anschutz Medical Campus. I'm also a team psychologist for the Denver Nuggets, and I'll be talking with you today about managing distress and enhancing wellness during COVID-19. We're currently living in an unprecedented time with heightened levels of uncertainty and increased levels of distress. And I'm here to talk with you about some tools that you can use to help calm, settle, and relax yourself. The first one that I'm going to go over is deep breathing. Deep breathing is a great way to set off a relaxation response in both your body and mind. You'll first start by exhaling completely through your mouth, making a whoosh sound. Close your mouth and inhale quietly through your nose to a mental count of 4. You'll then hold your breath for up to a count of 7. Do whatever's most comfortable for your body. You don't have to go all the way up to 7. And then you'll exhale completely through your mouth, making a whooshing noise and, and also to a count of 8. So you want that exhale to be longer than the inhale. This will be one breath. Now you'll inhale again and repeat the cycle 3 more times for a total of 4 breaths. And I'll demonstrate what one of these breaths can look like. Feels good. Next, I'm going to talk about something called behavioral activation or scheduling something pleasurable. The idea behind this is to make sure that you're doing something at least once a day that is enjoyable, fun, and pleasurable. So, research that has looked at behavioral activation as a tool for both depression and anxiety has found that it works as effectively as cognitive therapy and even some antidepressants. Now, the way that you'll do this, and this is a chart that I like to use, is let's say the night before you're planning on doing this, you can write in your planned positive activity. And this is something that you've done in the past that you find enjoyable. Could be as simple as taking a walk, or maybe something else that you haven't done for a while but want to get back to. If you're unsure, you can also Google a list of positive activities, and you'll find plenty of resources. So write in when you're going to do it. Did you do it? Yes or no? And how is your mood before and afterwards? We know that as people do this, it can absolutely have an effect on their mood. And as with anything that we do, if we begin to track it, we also begin to change it as well. Next, exercise. Exercise is just fantastic. And if we could put all of the health benefits from exercise into a pill, we would all take that pill every day. So researchers have found that it can help improve mood, can help reduce anxiety, help with stress. And the big thing in doing this is making sure that you start slowly and choose something enjoyable for your exercise. Don't try to go out there and do the most difficult thing the first time, as you may get sore muscles, it'll be unpleasant, and you may be less likely to go back to that activity. Next, cognitive disputation is a tool that you can use to help with negative thoughts. When any of us are feeling overwhelmed or stressed, we can have negative thinking or irrational thoughts. We can think the worst things are going to be happen, and we're being challenged at this time. So through this activity, you can try questioning your thoughts by asking yourself a question when you're experiencing stressed or depressed or anxious thoughts. And you can ask a question such as, if my best friend or someone I loved had this thought, what would I tell them? Or if you were to ask or tell yourself that, how do you think that would be helpful? Questions such as these can allow you to respond in ways that are consistent with your values, being friendly, being kind, instead of reacting to your initial negative thoughts. Another way I like to think about this is that you would give your best friend or someone you love great advice. You wouldn't give them terrible advice. This strategy is a way of really finding your inner advisor and giving that gift that you would give to others to yourself. Now, this is one of my favorites, Three Good Things. This is a tool that comes from Martin Seligman and his colleagues at the University of Pennsylvania Positive Psychology Lab. The idea behind this is really to learn how to cultivate gratitude. And so for 1 week, ideally, each day you'll write down three things that went well for you in that day. These items can be relatively small. My partner made the coffee today, or large. I earned a big promotion. It can even be things like I saw a wonderful sunset, or that tree just looked beautiful. Give the event a title. For example, my daughter made a hilarious joke. Write down exactly what happened in as much detail as possible, including what you did and said, and if others were involved, what they did or said. Include how this event made you feel at the time and how this event made you feel later, including now as you remember it. Explain what you think caused the event. This is really important to write down why it came to pass. Use whatever grammar style you please, and don't worry about having perfect grammar or spelling, and also put in as much detail as you want. Researchers, as I mentioned earlier, Martin Seligman and his colleagues, found that, and this chart demonstrates this, that there were a group of participants who wrote down three good things, exactly as those instructions I had listed in the previous page. And there was a placebo group, and these folks just did their usual activities. And as you can see on this chart, that uh, before the before the activity, there were similar levels of depressive symptoms. And then 1 week up to 6 months later, those that participated in the three good things uh, had a significant reduction in their depressive symptoms. Now, one of the things I really like that's happening in Denver currently, to give thanks to all of our healthcare providers, especially those on the front lines, is the howling at 8 p.m. So I've been getting out there and howling. And I'm grateful that all of the people in Denver and beyond have been doing this to celebrate the work of our healthcare providers. Next, social connections. We are social creatures and we need relationships. Uh, this is a picture of a psychologist that I attended a training for many years ago, Dr. John Arden, and he talked about social connections in this way. We have these social brain networks that need to be fostered and kindled and cultivated through a lifetime. And those people who don't do this tend to be more depressed, more anxious, get ill more often, and get dementia symptoms much earlier than others. For example, we know that telomeres, which are the caps on the ends of our chromosomes, actually shrink with loneliness. So social connectivity, as in good quality social relationships, has multiple benefits to our immune system and to our mental health, even down to the chromosomal level. Now, in this time of physical distancing, in order to protect ourselves and others, social connections can be a little harder to achieve. So tools such as Zoom, FaceTime, Skype, ways that you can connect with your friends, family, can be a great way of maintaining those social relationships and connections. Next, I'll talk about sleep. Sleep is key, and many of us are experiencing disrupted sleep during this stressful time. One thing that I can recommend is that if you're finding that you're waking up in the middle of the night, you can do something called stimulus control. The idea behind that is that if within 15 minutes, if you're not able to fall asleep, get out of bed and go do something relaxing, boring. Don't go onto a screen, because your screen, so your phone, iPad, or computer, give off blue light, and that blue light can actually wake your brain up. Something relaxing, maybe those deep breaths that I mentioned earlier, or maybe a meditation exercise. When you begin to feel sleepy, then return to bed. And the goal really is to reconnect your bed with being asleep. The other thing you can do is make your bedroom like a cave. So you want it to be dark, cool, and quiet. Try to minimize damage during this stressful time. We can, many people are at risk for turning to alcohol or marijuana, and these just are not good treatments for feeling down or feeling anxious. Uh, you know, Isolation, as I mentioned earlier, can have an effect on our mood. So try to stay connected to others and considering reducing the amount of news that you're watching. We're receiving upsetting news on an hourly basis, and so minimize that to what feels best for you. And if the feelings that you're experiencing are just becoming so overwhelming, please, please contact your healthcare provider. They may be able to provide, they can provide you with the skills and tools that you need and connect you to mental health providers if needed. These are just some of the resources that I utilize for this talk, so and that you can consider getting. So going to the CDC has some great tools, the American Psychological Association, the University of Colorado Department of Psychiatry has COVID-19 resources. The National Alliance for Mental Illness, or NAMI, has some tools, as well as the Greater Good Science Center of Berkeley. That's where I pulled up the Good Things activity that you can try yourselves. Thank you very much. And if you have any questions or comments, feel free to email me at alex.reed@cuanschutz.edu. And I hope you find these exercises and activities helpful for your stress during this unprecedented time. Thank you and have a great day.